Is it started? Is it? Yep, we're good
Yeah.
now. Good to go.
Yeah.
Cool. Excellent. Thank you very much. So hi everyone. Really, really lovely to meet you and to hear a bit about all the work that you're doing. As you've heard, I'm Nicola. I'm a researcher at DEMOS. We're a cross-party policy think tank. So we basically just do a lot of research on a lot of different topics, and then advise local government or central government or other bodies on what we think they could be doing better. And we have been commissioned to do some of this work to support the London Health Mission. Specifically, this project was to speak directly to people in the local communities, to speak directly to the members of the public who are accessing or trying to access these services day in, day out, so that we can hear from them what the barriers are that they face when they're trying to access NHS health services, and also what solutions they want to see put in place to help to alleviate some of these barriers that they're facing. So things that we specifically wanted to understand was, how do people currently find and use health information? What stops them from accessing health services, especially online, and the changes that would most improve their health literacy and sort of make them more digitally included, where currently they're a bit more digitally excluded. In order to get this information, we did some background research where we identified those 6 groups that you saw earlier, including migrants, older people, people with learning disabilities, and people who've experienced homelessness. And once we had identified these 6 groups, we found local organisations who were working in specific parts of London that had particularly high levels of people, of sort of demographic of people within those demographics. And then we asked them to speak to their members to see who would be interested in participating in this project. We asked participants to complete a 2-week diary detailing any interactions they had with any health services, whether that be the NHS app or website, a pharmacy, hospital, dentist, mental health services, anything like that, so we could understand the types of interactions that they had, what went well, what didn't go well. And then we carried out 2 2-hour-long workshops with each group, where we could hear from them directly, not just what had happened in those 2 weeks that the diary was covering, but over the past sort of few months or few years, what issues they've come up against. And like I said, what sort of things they think could be put in place to help to mitigate some of those problems. We are going next week to be carrying out a final workshop where we're going to bring together participants from all of those 6 different groups who we've worked with. So we'll have a couple of people from who have experienced homelessness, a couple of people with learning disabilities, a couple of people from migrant communities. And so they're going to discuss together what sort of these solutions that they've all come up with independently within their own groups, which of those solutions they think are best placed to support the largest sort of number of digitally excluded people across the city. And on top of that, we've also carried out interviews with staff from these community organisations so that we can understand a bit better these sort of systems level barriers that are driving some of these more personal obstacles that we're hearing about from the participants themselves. Initially, and I'll do this very quickly, before we spoke to the participants, we did a lot of reading around, reading sort of reports from charities, from governments, from the NHS, so we could get a sort of broad idea of what it is that is disabling people who've experienced homelessness from accessing healthcare. I'm sure none of this will come as a shock to any of you, but what we found to be the most prevalent issues is the fact that a lot of healthcare is now being run under this sort of digital by default service design, by which we mean that people, sort of healthcare staff, assume that patients have access to mobile devices, to Wi-Fi, to data. They assume that they will be able to book appointments, to get results, to find out information through digital routes, which means that for people who aren't able to do that or aren't able to do that easily, it makes accessing these sorts of services very difficult. And for people with experience of homelessness, specifically, a lack of charge points or Wi-Fi, which is exacerbated by the closure of local libraries, public hotspots going behind paywalls, and then obviously the high cost of digital devices and data plans. That means that this just isn't possible for a lot of people experiencing homelessness, or is very difficult. And this cements a vicious cycle where someone will need medical attention. They aren't able to access it because they don't have easy access to digital routes. This means that they don't get the healthcare they need, or they receive it too late, which means that their health then worsens and they face deeper exclusion. So using all that information, we then sort of as a sort of base for our understanding, we went and spoke to some people who have experience of homelessness to hear what they thought. Before I tell you any of that, I just have a disclaimer to make that we're still in the middle of the project. So the findings that I'm going to present to you now are very top level. They're only interim findings. We still haven't done all of the sort of speaking to everyone that we need to do. So there will still be more information that comes into us that will feed into our final conclusions. We also haven't had the time to do the full analysis of the sort of all the conversations that we've already had. So like I said, these are quite top line. Once we publish the final report in August, September time, there'll be a lot more sort of detail and a lot more nuance, and maybe even some slightly different or some slightly new findings that will probably come out of the data once we've had the time to analyze it properly. As well as looking at digital stuff, we're also looking at barriers sort of non-digitally when people go into sort of face-to-face interactions, or when they speak over the phone. But as that's not the focus here, I won't be covering that. So as suggested by the initial research that we've done, the fact that people are forced down digital routes is not only a barrier in terms of accessing healthcare, but can also be really sort of dispiriting, make people feel almost like second-class citizens when they try to access these healthcare services but find that they're unable to. So we heard people being told that they had to go online. Even when they were physically at the surgery, standing in front of the reception desk, they were told that they couldn't book an appointment there and they had to go away and book it online. And even when they stated that they lacked internet access, they weren't then given the support that they would have needed to book an appointment. With this particular person, they said this made them feel brushed off. Like I said, that their needs are just not considered or not respected. As we talked about before, the basic infrastructure for digital access is absent for a lot of people. So having a smartphone, having Wi-Fi access, charge points couldn't be taken for granted. People talked about having to charge having to use USB ports on buses to charge their phones. Like I mentioned before, the fact that libraries are closing, or when libraries are closed, they can't then they don't have any access to the internet or to computers, and so they're just not able to do any healthcare, sort of digital healthcare at all at that point. The NHS app, we talked about that. People who've used it said that they found it very confusing. While it should be said that some people did appreciate how it can be useful to easily see your test results and get your medical history, a lot of people did find it confusing, difficult to set up, and really difficult to book an appointment through. Someone before mentioned the increase of good translation, online translation options. The NHS app, you can't change the language on it. And so this, again, is another barrier, obviously, for people for whom English isn't their first language, that it can be very, very difficult to access to even use the NHS app. And also people found when they would try to book appointments, they wouldn't necessarily hear whether their sort of booking had been accepted for a few days. And so this can increase anxiety because they don't even know if their request went through, let alone whether it had been accepted. Importantly, some of the solutions that people said that would really make a difference to them. This was honestly one of our favorite solutions that we heard from all of the groups that we spoke to. And it speaks to something I think that Dean mentioned in the comments earlier, something that he's heard is happening, but it didn't sound like he'd actually seen it himself. The idea of having a sort of touchscreen kiosk is similar to sort of sometimes you can go into a GP surgery now and like type in your date of birth and maybe your name, and it will automatically check you in without you having to speak to a receptionist. That same sort of technology in GP surgeries, in libraries, in community spaces, in spaces of public access, for people to be able to book their own appointments. So you might go into your GP surgery, say you want to book an appointment. They say, sorry, you can't do it with us. You've got to go online. Over there is the screen. That's where you can do it. And ideally, someone would have, or that there'd be a member of staff around who could support people who were new to using that technology. So therefore, people who lack smartphones or computers, data, Wi-Fi, would be able to book appointments as and when they needed them, when they had access to these public spaces. Mobile Skills Hub. So the group that we spoke to, I think they had like a mobile dentist who would sort of come along in a van every few weeks to support them. They sort of took that idea and said, well, why can't you do that for digital training? We've heard that specific community hubs are offering some digital training. They thought, well, if you could take that, make that more mobile, bring that on the road, then it would be easier to sort of reach a lot more people. This could specifically be focused on the NHS app or the NHS website, help people download it, set up their own accounts, and learn how to do things that they need to do, like book an appointment or access their test results. And then there were discussions about how to improve the NHS app. So currently, you might enter the NHS app, but then be directed to another app like Doctor Doctor or Patient Knows Best to book an appointment or to sort of be referred to hospital. This is really confusing. So people said they'd much prefer having the NHS app as the one and only source of your medical information. And then also for when people might not necessarily have access to those or easy access to those training spaces, embedding short videos, sort of YouTube style videos within the app that could sort of give you a tutorial on, if you want to find your test results, click this, then go sort of scroll down here, for example, to make it easy for people to understand exactly how they can use the app. And then also, as I mentioned before, it can be a source of anxiety when people don't know if the appointment they've tried to book online has been received. So they wanted immediate acknowledgement sort of via text or notification to confirm that request has been received. And then also we heard from this group people talking about being on waiting lists for a really long time for maybe mental health services or other specific NHS support services, and sort of being in a state of limbo, not knowing whether they were still on the list, whether they had been referred, how long it was going to be until they were called up. Someone said that they had sort of waited a year or so only to find out that they'd never been put on the waiting list in the first place. So they recommended that sort of being able to check, using the app to see where you are in the waiting list, having that functionality would help to alleviate that anxiety and that sense of abandonment. So as I said, we're still in the middle of the project. Next week, we're going to be speaking to a lot of participants, doing the analysis of all of that data and writing the report in July, for it to be published in August, September time. Once that is published, we'll send all the information to London Plus, who hopefully will be able to share that with you. And then you'll be able to get, like I said, much more nuanced and in-depth findings once we've had a proper look at everything. But I hope that for now that gave you a sort of a good overview of the sorts of things that we've been hearing. Thank you very much. Does anyone have any questions?
Thank you, Nicola.